I think in terms of manual therapy, I do tend to use it quite a lot as part of my treatment, but definitely not in isolation. Times when you may not use it are more when the patient has lots of hypersensitivity, for example, and so any kind of hands-on treatment tends to stir them up. And so then, there's no point in doing that. Certainly if patients can feel that they're getting improved movement, and then you can back that up with an exercise that they can do at home to maintain that, then, you get better buy-in from your patients if you don't do manual therapy and just give them an exercise, for example. I think it's times when you may not do it, times when you probably definitely should do it to get better buy-in. Let's think about what the patients also are expecting and wanting as well, because that does affect the outcome.
That this actually may be the first time somebody might be hearing of that term, sensory motor exercises, and how that's different than the kind of like the world's mind's eye of what physical therapy treatment actively looks like in terms of rehab. What are some examples of some sensory motor exercises that you use in your practice and in your research, just so you can explain visually for folks that might be visual learners or have never seen or heard of these sensory motor exercises for the cervical spine, whiplash, and concussion patients?
So we have about 4 different domains of exercises, I guess. And so one is sort of head movement control. So we have joint position error. So being able to relocate the head back to neutral, particularly with the eyes closed, being able to really finely move the neck in a very finely coordinated way, tracing a pattern or following a pattern. Then we have ocular motor control, so gaze stability, but with the neck, it's much more in that sort of slower movements and being able to maintain focus as you slowly move the neck. Eye-head coordination, so being able to move your eyes independently of the head, and trunk head coordination. So patients often are not able to keep the head still while they move the trunk, and they move like as an en bloc. So that's an important exercise. And then you have balance and postural stability. So it might be doing things like particularly taking vision out of the equation. So things like balancing with the eyes closed, but then also walking with head movements. So large range head movements and those sorts of things. And those exercises can be, have shown to be effective on their own, but we know that most things are effective in isolation, but when you combine them, you get a much better outcome. So they're really important.